risks of fat transfer are extremely manageable. Because this is a scar-free technique, we remove the fat through a very small entry point, just a few millimeters wide, which is usually invisible after just a few weeks. And since we inject this fat into the shaft and glands of the penis using a very fine cannula, there are virtually no scars. This also means there are no issues with wound healing or any other complications. No need for changing dressings or anything like that. You don't even need to have any stitches removed. So basically, in terms of risk profile, this procedure is absolutely manageable. I always tell patients during consultations that, for me, the biggest risk is that we might not retain as much fat in the end as you, the patient, would like, and as I, the doctor, would also hope for. That means we could lose too much fat, and as a result, the thickness of the penis could decrease again. But serious medical risks, especially, for example, any impairment of erectile function or the general function of the penis, are basically ruled out. This has never happened here at the Rosengarten Clinic. And that's what makes penis thickening with your own fat an extremely safe procedure. A question we get asked again and again is, when you inject this autologous fat into the area between the erectile tissue and the skin, what does it feel like? Is it different during an erection or when the penis is flaccid compared to before? There are a few things that need to be explained about this. The autologous fat is injected into a specific layer and, of course, feels rather soft when the penis is in a relaxed state. It gives the penis a somewhat rubbery firmness and also a certain plumpness. So in terms of feel and touch, right? It also feels that way, but during an erection, when the erectile tissue fills up and pushes the autologous fat to the side, it becomes relatively firm. It doesn't get as hard as the erectile tissue, but it's also not as soft as when it's flaccid. If we base it on the experiences that all our patients have shared with us over the past years, then none of these patients have been bothered by the penis being soft or floppy in any way. In fact, when it's flaccid, it doesn't really matter that much anyway. In that state, the penis definitely has more volume. And when it's erect, the fat is pushed so firmly to the sides that it actually becomes relatively hard, which also contributes to a better thickness during an erection.